everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine. And on tonight's program, we're going to discuss a very important topic. We're going to discuss some common home emergencies. And we're going to discuss some concepts in basic life support. With me in studio tonight is Mr. Ababa Baptiste. Mr. Baptiste is the lead paramedic instructor at Tech EMS Institute. Okay? Mr. Baptiste, nice to meet you. Nice to have you on the show. Thanks for coming on.
No problem, Dr. Right. It's my honor. I'm welcome.
Thanks. So, Ababa, if you could just give our viewers a little idea of why this training is important. Why is it important for the general public, not just paramedics and doctors, to know about emergencies and basic life support?
Well, there is a saying, better have the knowledge and not need to use it than need to use the knowledge and skills and not having it.
Right.
So there are simple things one can do if there is an emergency to preserve life until the professionals arrive.
Right.
And we'll go over some of these things in a little bit.
So, Baba, if you could just give the viewers at home a little idea about your background and your training.
Sure, no problem. I'm a paramedic that was trained in New York.
Yeah.
And I actually enjoy the program that I was involved in as an EMT, becoming that emergency responder. And eventually I climbed up the ladder from EMT in New York to paramedic and instructor. And since then I've been training doctors and nurses and EMS personnel in the discipline of emergency cardiac management from basic to advanced, inclusive of advanced airway management, ECG interpretation, and things like that.
All right. So one of the reasons I think it's very important to have you here, Baba, today, myself and yourself have known each other for many years.
Yes.
And we have certified, I recertified with you, and you're someone I could always pick up the phone and talk to you about any kind of emergencies that I had, go back over what happened, and see if I could improve myself. But why I thought it was important to introduce you to the viewers at home is because I don't think our viewers are getting enough information about things like basic life support and interventions that they can do in an emergency to save a life, basically. And anyone could be a bystander. Anyone could be called into action at any point in time. And it'll be great to know that you have more people out there in society who knows how to react, what to do in the case of an emergency. The more people we have trained, the more people who understand what to do, the better the outcomes for the patients.
That's very important. Correct is right. And simple things one can do. Simple things.
Exactly. So we're going to start off with a very, very common emergency. And today's episode is pre-recorded, so we won't really have much time, or we won't have the capacity to do the questions and answers. However, our viewers can feel free to leave the comments on our Facebook page. So, Baba, one of the most common emergencies, especially in an adult, is choking.
Yes.
Everyone sit down home watching the show at dinner time. Suddenly, one of the guys get up, I'm choking. I can't breathe, or somebody's choking, somebody cries, oh, this guy is choking. What do we do in a situation like that?
Okay, so what one has to do is acknowledge that it's happening. So, for instance, if you're choking, one might have the universal choke sign.
Right.
So if you can...
But I will demonstrate it. So let's pretend I'm choking.
Yes. So one who's trained would say, are you choking? They're not supposed to answer. So once he nods, he's choking. It's a complete airway obstruction. I'll go behind. I know CPR can help. Take your hands and make a landmark. You're going for the belly button and the xiphoid process, by the ribs, or thereabout. Make a fist, go in between that landmark, and encuff the hand and make in and upward motion. 1, 2, 3. You do this until the object is expelled or the victim becomes unconscious. If the victim should become unconscious, you would take them down to the ground, supporting their head so that they wouldn't hit the ground. And while they're on the ground, you would start compressions to continue the dislodgement of the object.
All right. So I'm just going to stop you there, Baba.
Yeah.
All right. So if you could just show the viewers really slowly.
Sure.
This maneuver is called the Heimlich
maneuver,
Heimlich maneuver. If you could show the viewers really slowly, because I really want the viewers to understand it. I mean, this is no substitution for in-person basic life support course.
Exactly.
But if we're going to show them, I want them to see the exact hand movement. So you can slowly do it on me again, please, Baba.
Certainly.
Okay.
So what one do is when they acknowledge that one is choking and they establish,
show them the hand movement.
They let them know, hey, I know CPR can help. You hold your on the shoulder, go to the back, place one leg in between their legs, take the other hand, make a a sign like when you tell somebody from a distance, give me a call. You take the pinky finger, you put it at the umbilicus or the belly button, and the thumb goes where the ribs meet, where we call the xiphoid process. You take the other hand and you make a fist with the thumb inside. You go in between that landmark of the thumb and the pinky finger, you encuff the hand, and then you make in and upward thrust. 1, 2, 3, 4. You do as much until the object is expelled or the victim becomes unconscious. If they become unconscious, you support them so that they would not hit their head and have a concussion down to the ground.
All right, so we're going to do CPR a little bit later on. So,
yes.
All right, so folks, that's the called the Hemorrhage maneuver.
That's it.
You could replay this video, you could watch it on Facebook, but the hand positions is very important.
Yes.
And the fact that you're going in an inward and upward motion.
Simultaneously.
Yes. And that increases the thoracic pressure.
Exactly.
And allows the object to be expelled.
Correct.
All right? So, that's if you have someone around or that you are not the actual choking victim. So, Baba, what if you're by yourself or the person is by themselves, there's no one else around to help them, and they are choking? What can they do to save their own life?
Well, that is simple. One just have to relax and think quickly and get a chair.
Go ahead.
So you have to get a chair close to you, and what you would do is place yourself over, but you got to spread your legs so that you'll have this action of 1, 2, 3. You keep going until the object is expelled. Mind you, you cannot have your 2 feet together because you will topple over. So you got to position yourself where you spread your legs and you basically get the chair to actually do the Hemorrhage maneuver for you. Yeah?
All right.
And that works wonderful.
All right. So that's a very good substitute if you have no one else around.
Exactly.
All right.
And sometimes somebody's around, but they're not trained.
Exactly.
So you help yourself in that way, if you know what to do.
In addition to in choking, Baba, some of the people are very obese.
Yes.
And sometimes it's very difficult in Trinidad.
Yes.
To get your hands around the person to do a proper Hemorrhage maneuver.
Correct.
What can we do in those circumstances?
Okay. That is very simple as well. One has to get...
If you could describe it. I know
Yes, one has to get that person close to a wall. Mm-hmm. And once you get them against a wall, you would go in between the chest for obese or pregnant that you cannot get your hands around, and you would actually press against the chest bone. 1, 2, with the wall giving resistance as hard as you can for the object to be expelled.
Okay. All right.
If one can get their hands around the obese or pregnant, what they would do is go by the chest. So if it's an obese male or a pregnant female, you go at the chest. 1, 2, 3 at the chest. For the pregnant, who you can get your hands around, or obese.
Okay.
Between the breastbone.
All right. Thanks,
Yeah.
Bob.
You're welcome.
So I think that's very important information for people to help someone who is choking, right? And a little bit later on, we'll probably show it in infants as well.
Yes.
Okay. But another common emergency that I wanted our viewers to learn about is what can they do if they come home or they go out in the community and they find someone collapsed on the ground. What do they do?
Okay. Well,
I think the most important thing to start to answer my own question, the most important thing would be to call for help.
Yes.
Right?
Yes.
Or call for help. Don't assume other people have done it before. You call for help. But
yes.
What do our viewers do?
Okay. So one of the most important is to make sure that the scene, the area is safe. So there is no danger for one that would be trying to assist, because they can be on the ground because of some situation that caused them injury. Right. So you have to make sure the scene is safe. Once it's safe, then you would approach the person, and if they're on their back, you will tap and shout, "Are you okay? Are you all right?" No response, you will call out, "Help! Someone please help." And then what you would do is look for any signs of life, as in movement, for the eyes, the mouth, the nose, any kind of chest movement. Once there is no movement, then we start compression, which is on the chest, right to the middle between the nipple line, average on the breastbone, lower half of the sternum. We start compressing the ball of the palm and the middle of the chest, fingers interlock, elbows lock, and we start 1, 2, 3, 4, 5. We do as much as we can do until help arrives, because it is not encouraging to place one mouth on a victim that we don't know.
So, Baba, over the years, there's had some changes in basic life support. they've had some changes in basic life support mechanism. Before in the past, it used to be 15 compressions to 2 breaths, right? But they've had some changes, so I'm glad that you're pointing that out so people know what the current practice is.
Well, yeah, no problem. Well,
tell me.
There were different things for many years, 5 compression to 1 ventilation, then they changed to 15 to 2, then it went to 30 to 2, then it's still 30 to 2, but it's 15 to 2 for a 2 rescuer pediatric rescue, which is anyone that's a child or an infant,
Right, so you're telling viewers at home, if they meet someone who is collapsed on the ground, they check, make sure the area is safe.
Yes.
They check to make sure the person is breathing or not.
Correct.
If the person is not breathing, do they check for a pulse?
Well, we don't encourage the lay people to check for a pulse because they may not know where to check and what to check. You see, for a professional, we check for the carotid artery, for a carotid pulse, which is right by the middle of the neck to the side, you know? But for the lay people, we just look for signs of life. And one thing I want to mention, as far as it relates to compressions, is 30 compressions to 2 breaths. But if we are not giving breaths because we don't have the appropriate device, which is a bio device or the equipment, we just do continuous compressions until professional help arrive.
But if you could just really slowly show our viewers at home how they place their hands.
Sure.
And where exactly on the person they place their hands.
Okay.
And how to do proper compression.
Certainly. Well, I want to keep it simple. The breastbone, known as the sternum, we use the lower half of the sternum. So this is the middle of the sternum, which is kind of aligned to the imaginary nipple line. So at the lower half of the sternum, we would place the ball of the palm on the lower half of the sternum, avoiding the xiphoid processes where the ribs meet. And then we would interlock our fingers and lock our elbows and commence. 1, 2, 3, 4, 5. And you continue. You don't have to count because you would be doing this until you are exhausted or someone come to assist you, We push hard, we push fast, and we allow for full chest recoil. If you look at this mannequin, it has some feedback devices showing you 2 green lights on the side, meaning my compression depth is good and my rate is good. So it's an average thing that one would be doing, pushing hard and pushing fast, but not exhausting oneself where you will collapse.
Okay. And how much force does a person put on the compression?
Well, you want to go as deep.
Because people might be scared that they might damage the average person would be scared that they damage the ribs or they break something on someone.
It's better to push hard, and if a rib is broken but the compression is effective, you save a life, you broke a rib. That's better than trying to save a rib and you lose the life.
Exactly.
So it's called limb over life.
Okay.
So it's okay if a rib is broken, but the life is preserved.
Exactly.
Now you try to preserve the rib, but then you lose the life.
All right. So just going to go over the scenario again, right? Baba, person on the ground, they collapsed. Our grandpa or grandma walking down the street, they see them, they call for help. Please, someone call an ambulance. Please, someone help me. This man is on the ground. They look around the environment to make sure it's safe. Because it might be an unsafe environment that put that person down. Correct. So you want to make sure that you are safe before you help others. Right? Put your mask on before you assist others.
Exactly.
And then you go towards the victim who has collapsed. Right? You shout out to the victim. You touch the victim. Make sure that
you tap and shout, you know.
Tap and
are you
shout.
okay? Are you all right?
Make sure that there's signs of life. If there's no signs of life, you go straight towards chest compressions.
Yes, and you made a good point. You see, if there are signs of life, then you turn them on their side to allow for if there is any vomitus, any substance in the mouth, it can run out, and you keep them on their side until the recovery position is what it's called.
Can you show our viewers the recovery position? I mean, it's a little rough on the mannequin, but that's fine. We're going to show the viewers.
The recovery position is recommended on the left side. It's called left recumbent. So what you would do is actually place them on their left side with one hand across their chest and the other under their head. This mannequin doesn't have any arm. One leg just slightly tilt over the other leg. So what happens is the left hand is under the face and the right hand is across the chest. And while they're on their side, if there is any kind of whatever substance in there, GI content from the stomach, it would release and not cause a further obstruction.
Okay. So they either put the person, the victim, in a recovery position. Making sure to support the head. Making sure to tell them the side to allow the passage of gravity to allow contents to come out.
It looks like this. One hand under the face and one hand on the side, and the foot just slightly tilt over and on the side, totally on the side.
Okay. And if there is no signs, they continue on doing the CPR, correct? Until someone comes, until the ambulance comes or further
If
help.
there are no signs of life, you keep doing the compressions until professional help arrives.
All right. That's great. Is there anything else they should do until help comes other than the CPR?
If there is access to an AED, automated external defibrillator,
Right.
the one should apply.
Let's discuss that a little briefly there,
Sure.
Ababa.
Sure.
Now, AEDs or automated electrodefibrillators.
External defibrillator.
External defibrillators are very common in a lot of countries around the world.
Yes, it is.
Right? I mean, I remember going to Miami there before the lockdown a few years ago, maybe about 5 years ago. And I remember seeing in the airport every few steps an AED device, a defibrillator device.
Yes.
I remember going to supermarkets, seeing a defibrillator.
Correct.
Ababa, why is a defibrillator such an important tool to have?
Great question. Just to simplify it quickly, what happens is when we go into what we call arrest, we are in what we call clinical death, meaning we are not in biological death until 4 to 6 minutes passes. So while in clinical death, in that first under 6 minutes, one has an opportunity to be resuscitated. And there are 4 rhythms when one is in arrest. And the 4 rhythms, just to keep it simple for the layperson, is 2 rhythms are shockable and 2 rhythms are non-shockable. So the 2 non-shockable rhythms is what you see on TV, the flat line, the systole, and then there's something called PA, but don't worry about PA. And then there's the 2 shockable rhythms, which is ventricular fibrillation and ventricular tachycardia. With ventricular fibrillation, the heart is quivering. So it's fast and it's quivering, so you don't feel a pulse. Because every pulse you feel is from the heart doing its contraction, boom, and then you feel a pulse.
Yeah.
So when it's too fast, quivering in VFib, you would not feel a pulse. Or it can be going so fast in ventricular tachycardia that you are not feeling a pulse. So sometime in ventricular tachycardia, you can feel a pulse, but there's a thin borderline where you would not feel a pulse.
Right.
If it's in VFib, quivering, and trembling, or VTAC, where it's very fast, then an external device with electricity can go to the heart and shock it, because the heart is an electrical muscle.
Right.
Yeah, it has natural impulses there. And once you have outside interference interfering with the electrical conduction system, it stops. And hopefully it will reset and start back normal.
Right.
And that's what the AED does.
Right. And
It gives an opportunity for the possibility to restart naturally.
to save a life.
Yes.
And the great benefit of the AEDs nowadays is that it's totally automated.
It tells you what to do.
The machine tells the lay person what to do.
So let me
it's
just
simple.
add this.
Yes,
You
go ahead.
must turn it on first, and once you turn it on, you follow the instructions.
And a life is saved.
Yes.
Right.
Once it's a shockable rhythm.
So that's our little plug. That's our little plug for everyone. We just want to push for defibrillators in much more public locations.
And they will look something like this, you know? This is a trainer.
Right. Cool. Can you show us how you attach the AED?
Sure. This is a trainer, so it's not real because we don't want no real AED here.
Yeah.
And once you take it out, you put it on. As you put it on,
apply pads to patient's bare chest.
so it's telling you.
Plug in pads connector next to flashing light.
So it said apply pads firstly. So you apply the pads, yeah? And you look, there's a picture telling you exactly where it would go. One go on the right side, what we call right midclavicular. One go on the left side, which we call left mid-axillary.
And there's a picture on the pads exactly of where to put them.
Exactly.
So the machine
Apply
tells
pads.
you.
Plug in
And it keeps telling you until you do it.
Exactly, but note it said apply pads, plug-in connector.
Yes.
If one applied the connector first, it would say analyzing heart rhythm, although they didn't apply the pads. So you must follow the instructions.
Must follow the instructions.
Apply pads.
And when you plug it in,
Connector. Analyzing heart rhythm.
so at this point, someone was doing compressions, I would
not
tell them
touch
stop
the patient.
compressions and wait.
So the machine tells everyone stop.
Yes.
Shock advised.
So now it's saying shock advised. I can tell somebody continue compressions while it's charging. And when it's ready to deliver the shock,
Patient.
then I can say, okay, stop compressions.
Deliver shock now.
And I am clear, you're clear, everybody's clear. Shocking on 3, 2, 3. Shock delivered.
Shock delivered.
Please resume CPR.
Right.
Begin CPR.
And it's very simple and effective.
Very good. Very good. All right, Ababa. So that's a really important demonstration of the defibrillator.
Definitely.
And we're going to take a little break. I know it's been a frantic start for you. A lot of emergencies. And when we come back, we'll discuss a little bit more.
No
so,
problem.
guys, we're going to take a short little break. I'm here with Mr. Ababa Baptiste. He's a paramedic trainer, and he's going through some common home emergencies. So we'll see you in 1 minute.
ACTN The Voice welcomes you to join us for our newest agricultural television series, Harvest.
Welcome to Harvest. We're doing it double again, north and south. This morning we start here in Brazil Village on Bethany Estate with Michael and Jacinta Mill.
You can look forward to a personalized tour around scenic Trinidad and Tobago, showcasing different agricultural practices and teaching us self-sustenance.
So Wendy, you're about to show me your bromeliad house.
Yes,
Oh, this is lovely.
this is what our customers refer to as the mecca for bromeliads.
Explore the many ways to make your harvest right for you.
So our chicken coop is more or less built at a height whereby it's easy for us to go and just remove the wood shavings into our barrow.
Now, you don't plant out your seedlings, you buy the seedlings, right?
Yes, we purchase our seeds.
Here we are on a not quite monocrop site, but we have rows of tomatoes, rows of sweet peppers, and then you have the Milnes polyculturing.
Join us every Tuesday at 6:30 p.m. Harvest, a new dimension in agriculture.
You're watching ACTN, The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice. ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here talking about some home emergencies, and I'm here with Mr. Ababa Baptiste. Baba?
Yes, sir.
All right, thank you very much for that demonstration earlier with the CPR, the defibrillator,
Yes.
and for choking an adult.
Right.
Baba, I know we don't have all the equipment, but if you could, one of the most harrowing experiences as an emergency doctor, which I was in a previous life,
Yes.
and it's still traumatizing, is to hear that scream of, somebody help me, my baby is choking, my baby is choking, somebody help me.
Yes, yes.
And even though we don't have the equipment, I want to show the viewers at home what to do if anybody ever comes to them and says, my baby is choking, help me, help me. Right? It's something that will traumatize you for the rest of your life.
I remember coming out of school in New York.
remember it too.
Somebody bringing a baby to me like first month while I'm on the ambulance, and it was seriously impacting on my ability, but I did my best, and God made everything work out.
Exactly. So, Baba, let's say a little baby.
Okay.
So the mother comes up to you
So
and
this
says,
is a little baby we'll simulate, right?
Yeah,
So
right.
give me this. This is a little baby. Folks, we know it's like a child size, but that's considered a baby. Tell me.
Baba, help me, my baby is choking.
Look what I'm doing. I'm going to support the head first of all, because infants, their head are heavier and larger in proportion to body size.
Okay.
So what I'm going to do is look quickly, ascertain that the infant is choking, and what I should see is bulging eyes. I should see tearing without sound, and I should see blue discoloration around the lips. So I should see all three, or two, or one. Nevertheless, once I see anything that's indicative of this pending doom, I will quickly turn the baby over, supporting the head. That's important. And the body along my arm. Why I'm supporting the head? If I don't support the head, when I do the back blocks, look what will happen to the head. The baby head will be like the neck is breaking.
Okay.
So I must support with a C-clamp and give 5 back slaps. 1, 2, 3, 4, 5. That's the infant, the baby. Turn over, support the head, and then I would do 5 chest thrusts at the imaginary nipple line. 1, 2, 3, 4, 5. I would look in the mouth. If I see an object, I would remove it with my pinky finger. If I don't see an object, I will continue the process of back slap, 5, chest thrust, 5, looking in the mouth. And I would go on and on until the object is expelled or the baby becomes unconscious. If the baby becomes unconscious, we place the baby down on a flat, hard surface, or we can keep the baby and do the encircling thumb. But in this case, I would show you with the baby, you can use one hand with less force and start compressions, or you can use 2 fingers. Remember, we are simulating, this is not a baby, but for a baby, you would be using 2 fingers or 1 hand with less force. And you do this until professional help arrive.
Okay. And when you say a baby, Ababa, what age group are you talking about?
Good question. Keeping it simple, but I'll throw in something there for the professionals. So a newborn is 1 week, 2 weeks old. That's a newborn. A neonate is up to 1 month. An infant would be from 1 month to 1 year. So a baby in layman's term is a year and under, yeah? Okay. And then you have a child who is from 1 year to puberty, adolescent.
So hold it in the hand and the back.
Yes.
Back slaps, as I call it.
Yes.
Is for less than 1 year old.
Yes, from 1 year and less.
Exactly.
Yes, yes.
Okay, and what if there's a bigger, older child that is...
Then if it's an older child over 1 year old, what you would do is, if they're standing, you can kneel at their height and actually do the helmet maneuver. So for children, we do the helmet maneuver, just like with the adult, but it will be less force. Okay. Yeah? And let me just mention, as with the adult, if you have somebody very tall, don't climb up on a chair and try to assist them with the helmet maneuver. If they topple over, you would actually be on the ground with them. So you have to let them stoop. You got to get into their head. At that point, one is hysterically panicking. So you have to get in their head. Please kneel, I can help you. And you get them down to the ground and you do your helmet maneuver.
All right.
Yeah.
So that's fine, Ababa. Now, one of the other common emergencies that I would see in general practice that people will talk about that they didn't know what to do, most of the time they actually do well at home, is what to do if a patient or someone in the community is having a seizure.
Okay,
so
that's a good question.
A layman walks in and suddenly sees someone or a family member on the ground shaking, having a seizure. What do they do?
Well, that is simple as well with best practice, international best practice. What one does is clear the area so that they wouldn't hit their head on any object, obstacle. And if you can put something soft under their head like a pillow, you loosen it. If they have on a tie or any constricting clothes, you would loosen it. But you put nothing in the mouth. It's a myth to put a spoon in the mouth so that they won't bite their tongue. That's a myth.
Okay.
You don't put anything in the mouth to cause a further airway obstruction. You clear the area and let them go through the process of the seizure.
Okay.
Until help
And you put them in the recovery position.
Yes, once they come out of the seizure, then there's a state that they look very lethargic. It's called the postictal state. You would rest them on their side until they get their bearings and they come back alert and oriented to person, place, and time.
Okay. I think one of the common mistakes that you see is that sometimes people try to stop them from seizure.
Yes.
And hold them and hold them. That's a mistake.
Very bad. It's like, it may sound terrible, but it's like a patient having a baby and you squeeze their legs and say, no, don't. You have to let nature take its course. So the seizure is unfortunate, but you have to let it take its course.
Okay, and protect them from hurting themselves.
Exactly, by clearing the surrounding area.
All right. So another common question that I would get is what to do, like, for example, injuries in the community is very common nowadays, right?
Yes.
What to do if someone has a hemorrhage or a cut in the lower limb? Because it's very common. I mean,
yes.
Sometimes people would get injured being attacked. They might get cut with a cutlass across the leg. Somebody might shoot themselves, security guards. Somebody might attack them, shoot them. A policeman may get injured.
Yes.
It's very common.
Unfortunately.
It happens.
Yeah.
And the lower leg tends to be an area where people get these injuries.
Correct.
Right?
Correct.
So let's just say we're talking to our policemen friends who I know watch this program, the evening shift in the stations. So our policeman friends, if they get injured while they're on their duty and they have a large hemorrhage or a large wound in the leg, what do they do? Or what does their partner or their friends do to help them?
Okay.
Until help reaches.
The main objective is to stop stop the bleeding, arrest the bleeding. And how we do that, we work with what we have. So if one has equipment, one can use the equipment as in dressing and bandage. But if one doesn't have equipment, one can get clean plastic bag as gloves, a clean piece of cloth to depress the area and apply what we call direct pressure to stop the bleeding, to form some clotting. And once that direct pressure affects the bleeding and it stops, then what one would do is bandage and tie it with anything that they have accessible to. Now, if that bleeding insists that it wouldn't stop, there is something called a tourniquet. And a tourniquet would totally arrest the bleeding. And one can create a tourniquet with any piece of cloth.
Right. So they are commercially available tourniquets?
Yes, they are.
Right? And I would recommend, I mean, it always puzzles me that you see security officers, policemen, whatever, with guns and weapons and so on, and nobody has a tourniquet on them.
Yeah.
A tourniquet will save your life.
Exactly.
A tourniquet could save your life.
That's
yes, there's a lot of debate about the use of tourniquets in emergency situations, but in a large hemorrhaging wound, a tourniquet, a proper commercially available tourniquet, could help save your life.
That's correct.
However, if you don't have a tourniquet available, you must make do with something.
Yes.
What can we do there, Baba?
You can improvise.
Yes.
And keep in mind, once you apply a tourniquet, you never release it. You let a doctor do that.
Exactly.
So we would use your limb, your hand, for example.
Yes.
So let's say there's a laceration here. Even if it's anywhere on the leg, you apply, after you apply your dressing and it did not stop. So
go ahead and do that sequentially, Baba.
Okay, so let's do this. There's a cut here, a big cut, and it's bleeding profusely. I apply some direct pressure. I have my gloves on.
Compression.
And with that direct pressure, it's supposed to help stop the bleeding.
Yeah.
If the bleeding stops, great. Then I would apply a bandage. And what I would do here is continuously go around my dressing and cover all ends of the dressing, ensuring
So let's slow there, Baba, so they can see.
All right, let me slow down a bit. So you basically cover the dressing entirely. And once you do that, because the bleeding has stopped.
And Baba, very importantly, this dressing should be tight.
Yes, snug enough.
It's snug enough.
Yes.
Because adding pressure,
Exactly.
compression.
Now, there are some things you can do to add additional pressure, which is do a twist over the laceration site.
Very good.
And then you can come back and do a twist again. But keep in mind, you don't want to put this too tight to constrict bleeding, actually blood flow to the lower part. So you want to do it snug, effectively stopping the bleeding, but not to affect circulation.
Exactly.
Yeah. And then one can tie it off simply. Anyhow you want to tie it off. I have this method that I use here, where I do like this. It doesn't matter. Once you tie it off, you tie it off. Don't tie it in a bow, tie it in a proper knot, or you can use tape. And because we are doing a demonstration, I wouldn't pull this knot all the way, but you tie the knot over the injury site. Yeah. But let's just say this device
move a little bit there.
Caused bleeding to continue. It wasn't stopping the bleeding.
Exactly.
So I would come now with my tourniquet and I would go just above. Things like this, you can cut it off or tuck it in. It doesn't matter. The objective is to stop the bleeding.
Correct.
But if it didn't stop, now I would come 2 inches above the injury site. Now keep in mind, the bleeding needs to be arrested. So the tourniquet must go above. It can't go below because it would defeat the purpose. So once you go above 2 inches, you'll make a knot. Never put it on a joint. So I'm away from the joint, yeah?
Yes, you are.
And you make a knot, and then what you would do is make another knot, but don't tie this knot too tight, like this. Stop, make a knot again, and what you're gonna do is take anything, a pen, a pencil, and you will place it right through the first knot, and you will turn and turn and turn until the bleeding stops. That's the tourniquet.
Very effective.
Now, when you apply a tourniquet, possibility exists that the person might lose their limb beyond the tourniquet. But it's better to lose a limb and save a life than preserve the limb and lose the life, as we mentioned earlier.
Are we talking about major trauma, major injuries?
Yes.
Cutlass,
bleeding that you can't stop.
Gunshot to that area.
Once you can't stop it.
Right.
And then, importantly, one must be mindful, after they tighten, secure this and don't let it unravel on its own because you'll defeat the purpose. So once you tighten, you use a little system like this, and you can use some tape now, like a bandage, and lock this off, yeah? Or any piece of cloth, whatever it takes to ensure it doesn't unravel, whatever it takes. Yeah,
that's very informative.
Yep.
So, Baba, you did that really smoothly and really well and very effectively, because I felt it with common bandages.
Yes.
However, for the general public, it might be a little bit difficult.
Yes.
And that's why it is important for everyone out there to go, especially for anyone who in a first responder profession, to certainly go and do the basic life support and the basic cardiac support.
Yes, or first aid training, or first aid CPR AD, yeah. And just saying, you can go anywhere you please, but we offer these courses. So I'm not saying, come to us and do it. You can go wherever you please, but we offer these courses at Tech EMS Training Academy.
Good. So, Baba, that's a major injury there, a major wound. Another common thing that people might have, like, I mean, we see it all the time, is, like, for example, nosebleeds.
Yes.
How would you that's a common home, might not be an emergency, but it's a home situation, it's a first aid situation.
Yes.
How do you recommend our viewers deal with nosebleeds?
And that's simple as well. If someone is experiencing a nosebleed, you inform them to pinch their nose and lean forward. Now, there's a myth, lean back. But once you lean back, then the blood, unfortunately, would start going into the esophagus area, and then they would be swallowing into the mouth. Let's keep it simple. And it would go into the mouth, So it wouldn't clot. But when you lean forward, it would actually form a clot and stop. So never let them blow that clot out until they arrive at the hospital.
So can you show us?
Yeah, so basically just pinch your nose. You tell them to pinch your nose. And if they listen, fine. If they don't take their fingers, let them pinch their nose and lean forward. And stay like that until the bleeding stops.
Okay.
Yeah.
And if it doesn't stop, it continues on, you take them to the hospital.
Without a doubt.
Exactly, and the ENT doctor will probably cauterize it.
Yes, yes.
Or pack it. I don't think they're doing much packing nowadays, but they will probably just cauterize it.
Yes, yes,
all right.
yes.
Baba, I realize I'm pushing you kind of hard to get all that through, but
it's all good.
Another common home emergency is burns. That's something that people call us about, take people to casualty. What can you do for burns? Let's say hot oil falls on someone, or when they're cooking, you get a burn injury.
Yes, yes.
So you could just take us through burns, maybe small burns, small ones, bigger ones. Is there any difference in the management? What can all people do at home to help themselves before they reach the emergency department?
Well, the number one thing is to always stay safe and ensure that one does not get themselves injured. So if someone got a burn, you got to make sure that you don't get burned. So whether it's hot oil in a pot, splash on them and the hot oil is still there in the pot. Safety is of the utmost. Whether it's an electrical burn, make sure the panel, the breaker is shut off. You got to isolate the electricity. Whatever the burn came from, you got to make sure you are safe.
Good advice.
And then what you do now is the person, you remove them from the source. Yeah. So let's say someone has a burn on their hand. You would run some cool water on that area. Don't put toothpaste and lard and butter. These things, it's all about a myth, applying these things. They keep the burn in process going. It's like putting lard on a plating. It would fry.
I think that's really important that you put that out tonight, because many times the doctors, well, I saw people coming in with burns and the family apply toothpaste all over it.
Yes.
Right? So that's a common misnomer, or you call it a myth.
Yes.
There's lots of myths out there, but you definitely don't want people putting toothpaste or
just cool water.
Or lard.
Yes. Cool water, cool water.
All right.
You know?
So it's this water alone is what they do?
Yes, cool water. And if you have clean dressing, you can apply if you have clean dressing, sterile dressing. If you don't, transport them to the hospital where they'll be taken care of appropriately.
Okay. Baba, other than burns, so that's the burns. I mean, larger burn management, obviously, they have no choice but to carry them into the hospital.
Definitely.
Where further treatment will take place, and generally it's a lot of rehydration as well.
Yes, correct.
Right?
Yeah, correct.
How about common things like heat injuries,
heat emergencies.
Heat emergencies.
Yes, well, heat emergencies are 3 stages. There's a localized heat cramp that one may get in certain areas in the legs, abdominal area. That the person just rests and it's fine, it will correct itself. And then you have heat exhaustion, where one is sweating profusely, and if one continues in that environment, they would eventually have what's called a syncopal episode. They will faint. They'll become unconscious. So with heat emergencies, you have to remove the victim from the source. So if someone is going through heat exhaustion, you have to cool them down with cool water and remove them from the source and let them relax. Now, the worst scenario with heat emergency is what we call a heat stroke. The heat stroke is a true emergency. It's a killer. And the heat strokes comes about when one is going through heat exhaustion and the mechanism, which is for perspiration, which is supposed to be cooling the body, shuts down. So one becomes dry and hot, really, really hot. And if the proper care is not given immediately, one will die. So in that case, you remove them from the source and you start cooling them down with ice in bags, ice packs under the armpits, by the groin, by the neck, and you keep them cool. And out of the source, you move them into air-conditioned space, transport them to the hospital. Wet blankets is fine as well.
All right, Baba, so we're just going to take another short break.
Sure.
And we're going to take a little break, and then we'll be back in one moment.
No problem.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. Nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
Trending and fun. Entertaining yet factual. Not your typical evening show. I'm Renata Singh. And I'm Kimberly Farah Singh. Tune into the evening show at 6 p.m. exclusively on ACTN The Voice.
Quick is the word. I guess when you're in the fashion business, and you'd have learned things like secondary contact and primary contact. We learn all kind of things. You're saying that the child is no longer a child, they're an adult.
6 p.m. never looked so good. Tune in to the evening show, your daily magazine show for all things current and trending. Lifestyle, cooking, fitness, special features, and much, much more. Monday through Friday at 6 p.m. only on ACTN The Voice.
You're watching ACTN The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice. ACTN The Voice, your family-friendly station.
All right, guys, welcome back. I'm Dr. Roopnarine is my name. I'm here with Mr. Ababa Baptiste, and we're trying our very best to give you some information as to how to approach common emergencies and what you can do to help someone in trouble. So, Baba.
Yes, sir.
Let's say we put out this video with your grade 7, your grade information.
Humble.
It's still very difficult for someone to retain what we said here. They don't go to their basic life support course, or they don't go to their first aid course. And they're unsure what to do, or they're unsure what to do when they come upon a scene. What would you recommend to someone to do? If all else fails and you go a total blank when you try to help someone, what do they do to help someone if they don't know what to do?
Well, one thing that's very important is activation of the emergency response system.
Exactly, that's what I was trying to get at.
Yes, so if one comes across a situation, you have to determine as best as you can, does this situation need an ambulance response? And sometimes it's hard, but it's simple at the same time. Because if one has a cut finger, you wouldn't activate the ambulance for a cut finger. Yeah?
No.
You know, you have to determine, hey, this thing is serious. This person needs an ambulance. Yeah?
Correct.
So there are certain conditions I know we'll talk about later that warrants activation of the emergency response system. So talking about that, in Trinidad, our emergency response number for medical emergencies is 811.
Correct.
And for police, we can use 999 and fire 990. In Tobago, for medical response, is 211.
All right.
Yeah?
So a very important point at this point in time is to tell people that you might come across a scene where you see loads of people there and you assume that someone activated the emergency response system. It's happened many times, and that it might be a wrong assumption.
Yes.
Right? It's called bystander non-intervention. I think it's what it's called in technical terms. There's actually a whole technical medical term for it. You take it upon yourself to call the ambulance.
Exactly.
Even if you see others there, assume no one did it.
Exactly.
All right?
Because if you do call and someone called before, the dispatcher will inform you that a call came in already.
Exactly.
So you didn't do anything wrong.
Exactly. So, Baba, one of the most, I think we can't finish a program. We have about 10 more minutes. We can't finish our program without going through the most important thing. Well, one of the most important things. Mama and Papa at home watching this program tonight, they say, hey, look, baby Baba there, you're doing a program with Dr. Roopnarine. Suddenly he gets up, feels a sharp, sudden pain to his chest. And he goes, Auntie, I think I get a heart attack. Call them, call Baba, tell me what to do. What do you recommend to people to do?
Okay. Personally, anyone experiencing such a situation, firstly, need to be calm and relax. It would only precipitate the problem if one gets paranoid and frustrated and anxious. But anyone else there need to give that person reassurance and activate the emergency response.
Exactly. That's a situation
where
you activate the emergency
you must call.
response
Yeah.
One time.
That's correct.
Yeah.
And keep them calm and cool.
Right.
Yeah?
Yes.
Ensure that if the place is too hot, get them into a cool space, air condition or a fan, or even fan them.
Is there any interventions that they can make before the ambulance arrives?
Well, there is simple things as baby aspirin.
Correct. So
if there are no allergies to aspirin. So one has to know, you know?
So I will just help you along there, Baba. Right? When I worked in the ER department in Ireland for many years, I would insist, and I don't know if it's in the books or not, but I would insist that my patients, whoever comes in with chest pain that looking like a heart attack, that they get 300 milligrams of aspirin, right? And in Trinidad, we have 81 milligrams. Is the normal dose?
Yes.
So let's round it up to about 4 tablets of aspirin.
Yes.
Because there's a golden rule in medicine. Time is muscle.
Yes.
Especially when it comes to heart muscle.
Correct.
The longer you wait from treatment, from getting the pain or having a heart attack to getting active treatment, could be disastrous.
Correct.
So when I was a ER doctor, I would insist that my patients get 300 milligrams of aspirin. Even before they reach the hospital. I'll be calling guys like yourself.
Yes.
And even if they have a drug called Plavix, which you may or may not have at home.
Yes.
So aspirin is a very important intervention for heart attacks, if you're really certain that somebody having a heart attack. And no harm is done.
Exactly.
And aspirin could help save heart muscle.
Correct.
Right? And that immediate journey into the hospital. At the hospital, there would be further interventions. There's something called thrombolysis. Or they could take the person to the cath lab. And all those interventions are done to cut down the time from heart pain to treatment.
Correct.
So, Baba, another common complaint, right? I'm just going to bring it down to more home emergencies, is I had one today, a bee sting. Someone came out with a bee sting. What do you tell people to do when they get bee stings? Or insect stings?
Well, bee stings or insect sting, hopefully the person who is the victim, hopefully they are not allergic to the venomation. If they are allergic, then the bee sting, the stinger, needs to be scraped off, not with a tweezer. A tweezer would only cause further venomation to take place. You have to take a hard plastic ID card, license, credit card, and scrape off the stinger.
Yes.
And you can wash the area, and if you know that they have allergies to this bee sting, try and get them to the hospital if they start complaining of trouble swallowing, because if they have trouble swallowing, they start itching all over. Itching is localized. But if they start having what we call laryngeal edema, where is a release of histamines in their throat area, larynx, and they can't swallow or they can't breathe properly, that's a true emergency, and they need to be seen. They need to get certain medication, as you know, epinephrine, as a bronchodilator,
because it represents an anaphylactic reaction.
Yep.
All right, so bee stings, insect stings. I'm just going to break it down for the audience again. Just swipe away the stinger. You don't want to get a tweezer, because using a tweezer, you could actually squeeze the area where they have this sort of venom.
Stinger is in there,
and then you're going to release more venom. So you just scrape it off.
Yes.
And sometimes you're going to look like what happened to me today, and I'm not seeing anything. That's fine, because the guy probably scraped it off himself and didn't realize.
Yes.
And then you give a little pain relief. Panadol is sufficient. A little antihistamine if necessary. Allegra or whatever. And a little bit of antibiotic, probably a little steroid cream.
Yeah, so a good thing to keep, I mean, you would confirm that as a doctor, is for people who have allergies, they would know this anyway.
Exactly.
Is, you know, Benadryl, Allegra, Puritan, keep these things. They're over-the-counter OTCs, you know?
Right, exactly. Baba, how could we recognize, or how would our patients at home or viewers at home recognize if they're having a stroke, and what can they do?
Okay, oh boy, that sent me back when I had mine.
I remember when you had yours.
Yeah, but it's all good.
It's all good.
What I have to say is, it's an unfortunate scenario. And should one witness this, or should one experience this? Rule of thumb, stay calm. Stay calm and activate the emergency response system. Being hysterical and frustrated only participate the situation, makes it worse. So one has to stay calm. But you can recognize when someone is actually gazing at you and their hands drop, or they might even fall, or they start speaking on their tongue and like,
slurred speech.
Yes, slurred speech, a heavy tongue. Or you may see what we call facial droop, a drop. I still have a little drop on my right side. If people look closely, they would see it.
Right.
So once we recognize these things, we need to activate the emergency response system and stay calm.
Right. And the loss of power in the hand it's the hand that basically loses power.
Yes. The nervous system is not working there, unfortunately.
So for strokes, I think it's very important the recognition of what is a stroke in the community.
Yes.
The obvious signs before, and then at least you know that you recognize a stroke, and this person needs to go straight to the hospital.
Exactly, correct. Because brain is time again.
Exactly. Now, we're not giving any medications.
No.
We're taking them straight to the hospital. The reason we don't give medications for strokes at home is sometimes we don't know whether it's a clot or whether it's a bleed. And the trained ER professional with imaging sometimes will determine that.
Yes.
Right? And we don't want to give medications that might interfere with, make a condition worse. Correct. So once you recognize a stroke, you take the person straight to the hospital. That's why you need to have a little idea or knowledge on how to recognize a stroke.
Yes, well, I was lucky my stroke was a clot, which is, you know, what we
So,
call
Baba, what symptoms did you have when you were having a stroke? Did you recognize that you were having a stroke yourself?
Eventually, while it was evolving. Yes.
What happened?
I was about to go to Montauk to do some training, to train doctors in advanced cardiac life support.
Yes.
This was in 2015. And it was 5 a.m. And when I got up, I started feeling very strange, like airy.
Right.
So I got a little concerned, a little scared, because it didn't feel right.
And then what symptoms?
And then I said, you know what? This is a dream. Maybe this is not real. So I closed my eye, and something said, open your eyes.
Yes.
When I open my eyes, the feeling persists.
Yes.
So I called my wife. I said Nyla, but it came out like, no.
You were slurring your speech.
So I had the slurred speech. When she
Did you recognize that you were slurring your speech?
After, when she looked at me and she started screaming, because she saw the facial droop.
Right, she realized that you were having a stroke.
Yes.
And then you activated it.
Yes, and we called 811, and then I realized I had weakness on the left.
Right.
And I couldn't walk, poor gait, and you know.
So that was just
it's an experience that I thank God I remained calm, and that helped me to recover quickly.
Yeah, you certainly did. And I put that out there so the viewers will understand the symptoms and be able to recognize if it happened to them.
Yes.
So, Ababa, we're kind of coming towards the end of the show. Tonight's show was pre-recorded, so we didn't have much viewer interaction. Usually people call the program and ask their questions.
Yes.
But because of little difficulties to manage with the equipment, we did it pre-recorded. However, I encourage the viewers to So just give us some feedback. We tried our best with what we had, with whatever equipment we had. Give us some feedback on our Facebook page. If you're interested in doing your basic life support, your first aid course, which I highly recommend, Ababa is a good teacher. He's very understanding. He takes his time and explains things. Sometimes doctors need to recertify in cardiac life support. Ababa is also a very good teacher, and I have to do my recertification with you in a few months' time.
Sure,
All right. Problem. So, guys, we come to the end of the program. I really hope you enjoyed it, and I would like to take this opportunity to thank Ababa for coming out here today, for trying our best to teach the viewers, to give them some help, to give them some knowledge so they could help each other and help themselves.
And I'd like to leave my number if anyone wants to take a note of it.
You could go ahead. You could go ahead.
Our number, Tech EMS Training, is 303-8324, or direct line to me, 731-4712. And we do training in first aid for lay people. We do EMT for working on the ambulance, AEMT in the oil and gas, paramedic in the oil and gas. For doctors and nurses, advanced cardiac life support, pediatric advanced life support, and of course, basic life support, which is the foundation for these advanced courses. And we have a nice course set up for instant emergency ECG interpretation, advanced area management with intubation, and IV cannulation. So it's an honor to have me, and I'm humbled and honored. Thank you, Robin.
No problem.
Thank you.
All right, guys. So that's it. Thank you very much for joining us tonight. We'll be back next week with our live program. We'll be having some discussions. We're going to be doing rheumatology next week. I hope you enjoy the program. Keep safe. God bless. We'll see you again next week. Take care, everyone.
Safe.